Hi guys, welcome back to my channel. So if you don't know me, my name is Romail Zahir and I'm a fourth year medical student at King's College London, and today is going to be the start of my third block. So it's January, now January 16th, and we're going to be starting our third set of rotations out of 8, heading it's out of year 4 and 5. So for this block, I'm placed in pediatrics, so I'll be going through numerous wards, so assessing neonates all the way up to kids under 16. So yeah, so it'll be very interesting. It's a whole new aspect of medicine that I've never been exposed to before, so I'm very excited for that, and I'm glad that you'll join me too. So I make a whole vlog for this. And yeah, so today I'm going to be placed in the pediatric assessment unit. So this is basically hand in hand with the pediatric A&E. So cases come throughout the day and then you assess them, triage them, and then send them on their way as appropriate. So yeah, catch you around. So basically the ward policy for that round is you need to be in your scrubs. I'm just going to go back to the changing rooms and change into my scrubs. So I just finished side at 9, it's 3 p.m. So going back to the flat now and I'll update inside how the day was. I'm back guys, I'm back into my room, and a quick review of today. So I was in the pediatric assessment unit where after being triaged from A&E, people get filtered through and then we send them out to the respective wards. So firstly, I was with a very good consultant, and the consultant pediatrician, he sat down with us. It was me and one of my colleagues, and we just reviewed the different type of presentations within the PAU, and these included like cardiac presentations or respiratory presentations or more like gastro presentations as well. So then we took it from there. And yeah, that was very helpful. The consultant was very friendly, was very informative, and was very good at teaching, so we learned a lot, and time went quite fast. I went at 9, and yeah, so now it's like around 3, so 6 hours straight in the ward. It didn't feel like that at all, so that's a good sign. And yeah, so from the patient side, so it wasn't that busy at the start because it's a Monday morning, but gradually it gets busier throughout the day. So I got to see 3-4 patients alongside the consultant, and some of these include like a 5-month-old who came in with bronchiolitis, and the mum was concerned regarding the symptoms and how to manage them. So we just went through with the mum how it's a viral infection, so just wait it out and rest at home, and it can last anywhere from 4 to 6 weeks or even longer in certain kids. So yeah, and then the consultant was very helpful. He sat down with us afterwards and told us how to look at different type of presentations and manage them differently. So if someone comes under 12 months with these sort of symptoms like cough, wheeziness in the chest, whatever, so we treat that as a bronchiolitis, and we do more of a conservative management. And if they're over 12 months, then we can do a bit more down the treatment aspect, so give antivirals or yeah, IV steroids in the severe cases. So yeah, that's quite good in that regard. And yeah, so we had another patient, and this was an Afro-Caribbean child, 5 months old, and he presented with vomiting and a bit of a runny nose. And yeah, so we went in, did a full newborn like baby exam, did the 360 maneuver, so lift them up, lift them straight backwards and see the baby's posture. So it's basically like a infant neuro exam, so that was quite cool. And yeah, the baby again, blood tests were fine, and yeah, urine dipstick was fine as well. So we were suspecting another viral infection as well, so we told mum to keep the baby on Calpol or Nurofen as applicable and take it from there. Another patient of note we saw was around us, I think it was 2-month-old baby, and he was presenting with slight ache in his joint, so the baby would be quite distressed, like in the lower limb on the left side. So we examined them and we saw if there's any other presenting factors. So we were trying to rule out septic arthritis, anything reactive arthritis. So this normally happens if there's a preceding viral infection. So if there's like a sore throat or any sort of infection before, which wasn't the case, so that's good. And yeah, so we released the child, discharged home, and we'll review in 5 days to see if it's cleared up, which it should naturally, as there was nothing to report on examination or blood test. that rounds up my clinical aspect of the day today. So now I'm just going to get changed and then head off to Starbucks in the nearby mall and do a bit of revision there, as that's one of my revision spots. So thank you for joining me throughout the day. So I spend my time going over my 0 to final flashcards, and yeah, very good way of revision. What's up, guys? Welcome back. So today's Tuesday, the 24th of January, and today I'm going to be back on the ward in pediatrics, so the same pediatric assessment unit, so day 2 in there, and it's nice and early, 8:30 a.m, so I'm going to quickly go grab a brekkie from Costa, and then we'll head to the wards. Porridge for brekkie. So after a very productive ward round, I decided to type up a bit of notes and get my sign off, which was a case-based discussion of observed history taking in pediatrics. And then I logged in on the ward computer, and this is me typing up the notes. Hi guys, welcome back. So I've just finished my second day on the ward. So again, I was in the pediatric assessment unit, and today was a bit more hands-on, even though at the start again it was a bit quiet, which normally is here in the early mornings. So what I did was just spoke to the consultant again and went through some conditions and how to deal with them. And yeah, so then time now is 12, and then I was there from around 9 till 12. So was productive after the first hour. So what I did was, as the patients came in, I took a few histories, and then one of them I presented to the consultant who signed me off for my mini keg. So this is like for my portfolio, I have to do a few sign-offs, so it helps with that. And yeah, so I'll give you one example of the case I did today. So the one I presented the CBD for, there was this 2-year and 3-month-old baby girl. She came in with a history of constipation over the past 5 months, and the mother's very anxious and agitated about that, as expected. And she's attended around 3 different A&Es over the past 6 months regarding this issue. So yeah, so she was very agitated, and she wanted a few more answers, which she's lacked in the past few months. And yeah, so upon speaking to her, when I gathered the history, I realized that she's tried a lot of different medications and they're not helped. So there's one phosphatase they used that didn't help much, and Senna, this medication you give for constipation, that worked for the first instance, but then it didn't work after the first time. So that's why the mother was a bit agitated, and she wanted a few answers and to cure her baby, because as upon examining the child as well, I could see that she was very distressed, and she was like shaking like this when ever she needed the urge to go to the toilet. But obviously if she's constipated, she can't. And another thing she told me was that over the past 3 days the baby stopped eating as well, so she just barely had like 2 raspberries 4 days ago, and it's just on reformulated milk, which obviously isn't good. And yeah, so feed's coming down. That's never a good sign in any infant or baby. So yeah, so then upon liaising with the consultant, we reviewed, and the consultant decided that we need to do an enema on this child, and maybe the medications aren't working because of the blockage in the bowels, so in the rectum. So we'll clear that up. So as you speak, they're probably going to the enema, and then hopefully the medication can take effect and they can take it from there. So I got my CBD signed off, which was my target for the day. And now I'm just going to do a bit of revision on my flashcards, which I have down here. So I highly recommend get these, very helpful. So I'm halfway through now, so trying to go through them. And yeah, after that around 2 p.m. I'll have a teaching session, and it's going to be on bronchiolitis, so looking forward to that and learn a few more about pediatric conditions. And then after that I'm going to head off to London because I have a event at the High Commission. And yeah, so it looks like another productive day, and thank you for joining me at the hospital. Quickly reviewing some flashcards before I'm off to teaching.
Including common cold virus. So there are 10 different viruses, or 10 or 12 different.
Got to catch a very beautiful sunset on the way into St. Pancras. just running late. Today's Thursday, so I've got Oski practice. So yeah, we're going to be doing child health related Oski stations and how to approach them. So yeah, start of my day.
Some people do end up having legs amputated.
So guys, I've just finished my Oski practice, and then after that I had what's it called? We had for the quip, we were going around wards speaking to junior doctors regarding different things and like for our quip, so asking them the experience about lumbar puncture, and basically we have to shadow a patient throughout the quip. And we found our patient. It was like a 67-year-old who came in, and he had needed lumbar puncture to rule out brain hemorrhage, and we spoke to him about his experiences, how he found them, etc. And that was quite good. And yeah, then we asked like 5-6 doctors to fill in our survey, junior doctors, F1s, F2s, and it's good talking to them, getting an insight into their lives, how it is here, Darren Valley. And yeah, so just gonna go back in, do a bit of revision that I need to catch up on, and I'll update you guys after. So guys, just to wrap up the week, and first of all, very sorry for the delay. I've been very busy with stuff as well throughout this week, so I didn't get a chance to update you all for the end of the week. So basically I'll sum up the last 2 days of the week. So Thursday, Friday. Thursday I had an Oski practice session with one of the consultants, and that was quite good. So a couple of my colleagues, they were in, like, let's say one was a student and one was a student doctor, sorry, and one was a parent coming in with a child, and then we had to do like scenario, and then you went through it, how to approach it, how we answer, and the differentials, etc. So it was a very helpful session. The doctor was a bit busy as the PAU was very hectic that day, so we only did one station, but it was quite good, and we have another one scheduled later on in the block, so that's always good. And yeah, so in regards to the last few days, I spent a lot of the days revising and doing my flashcards, and yeah, so I'm using the 0 to final flashcards, and they're very helpful, and I've got majority of the conditions apart from pediatric and obs and gynae. So I've got separate 0 to finals, obs and gynae book and pediatrics to go through them. So yeah, that's also one of the main things I've been up to. And apart from that, in my spare time, just trying to fit in gym and meeting a few friends, sorting some stuff out there. So yeah, that was pretty much my week, and I hope you enjoyed this mini vlog, week vlog in my life. And yeah, so let me know if there's any particular videos you want, and if you could please put them down below in the comment section, or just message me on Instagram or anywhere, and we can look into that. So thank you so much for watching this video, and if you want, you can check out my old videos as well. And yeah, please don't forget to like and subscribe down below as well, and I'll catch you in the next one.